Hi, my name is David. I'm one of the medical students. Can I just confirm your name and date of birth?
Yusuf Smith, 1st of January 1993.
Hi, Yusuf. I'd like to perform an upper limbs neurological examination today. It's going to involve me testing the nerves in your arms and getting you to do a few movements. Is that okay?
Sure.
Are you in any pain today?
No.
Okay. So if you can lift your arms up like this for me, just with your palms up, and close your eyes and hold it there. Good. Now open your eyes and relax your arms. So I'm just going to test the tone in your arms now. So if you just keep them floppy for me, I'm just going to move them around, okay? So. Okay. Just going to test the strength in your arms now. So if you can just lift your arms up like this and just keep them up. Good. And keep them up. Good. And just relax them down slightly. And don't let me pull them up. Good. Don't let me pull them up. Good. Arms up like this in front of you. And just keep them there. Good. And keep them there. Good. And push out against me. Good. And push out against me. Good. Arms up in front of you and just cock your wrist back. And just keep them there. Good. And just bend them forward. Don't let me lift them. Good. Great. If you can put your fingers out straight in front of you and just keep them up. Good. And keep them up. Good. And spread your fingers for me. And just keep this finger out. Good. And the same on the other side. And just keep this finger out. Good. And spread your fingers again. And just keep this finger out. Good. And keep this finger out. Good. And turn your hands over. Put your thumbs up for me. And just keep them up. Good. And keep them up. Good. And just relax. So I'm just going to test your reflexes now. So if you just let your arms go floppy, I'm just going to move them around. So I'm going to test your sensation now with this cotton wisp. It's going to feel like this. I want you to close your eyes and just say yes when you can feel it.
Yes. Yes.
Was that the same on both sides?
Yeah.
Good.
Yes. Yes.
Same on both sides?
Yeah. 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 Yes. Yes.
Was that the same on both sides?
Yeah.
Okay. I'm going to test some of your sensation just with this sharp pin now. It's going to feel like this. Can you feel that as sharp?
Yeah.
Okay. So I want you to close your eyes for me and just say yes when you can feel it as sharp. Okay.
Yes.
Okay.
Yes.
Was that the same on both sides?
Yeah.
Okay.
Yes. Yes.
Good. Same on both sides?
Yeah. Yes. Yes.
Same on both sides?
Yeah. Yes. Yes.
Same on both sides?
Yeah. Yes. Yes.
Good. Same on both sides?
Yeah. Yes. Yes.
Same on both sides?
Yeah.
I'm now going to test the vibration in your arms. I'm going to use this tuning fork. Can you feel that vibrating?
Yeah.
Good. Okay. So I'm going to test this in your arms. Close your eyes. Can you feel that vibrating?
Yeah.
Good. Tell me when it stops.
Stopped.
Good. So I'm just going to test some of your joint position sense now. Okay, so I'm going to move your thumb up and down. Okay, so this is up and this is down. I want you to close your eyes for me and tell me whether I'm moving it up or down.
Up, down, up, up.
Okay, I'm going to try the same on the other side. So this is up and this is down. Close your eyes for me and tell me whether I'm moving it up or down.
Down, down, up, up.
I'm just going to test your coordination now. So with this finger, can you touch your nose and touch my finger and go back and forth? Good. Try the same with this finger. Good. Great. And can you place one hand over the other like this and turn it over and go back and forth as quick as you can? Good. And try the same with the other hand. Good. That concludes the examination. You can get dressed now. Thank you very much. Today I performed an upper limbs neurological examination of Yusuf, a 30-year-old male. On general inspection, there were no stigmata of neurological disease. The tone, power, reflexes, coordination, and sensation were normal. These findings are consistent with a normal upper limbs neurological examination. To complete my examination, I'd perform an assessment of the cranial nerves and a lower limbs neurological examination.
If you liked this video, you'll love our textbook. The Geeky Medics Clinical Examination Guide summarises all the key examination skills for your practical exams. Buy now at geekymedics.com.